Look, we've been using the Airgent now for 10 months, particularly for fine lines on the face, the neck and the chest and the back of the hands. We also use it for acne scarring, and we find that for the fine lines it's particularly effective on the face, the neck, the chest and the back of the hands. And that's probably one of the big advantages of the Airgent, that we can treat areas that are normally hard to treat off the face, and we can treat large areas rather than just individual lines. We're very satisfied with the results. Patients have been happy and we're happy. It's a new technology. It's allowing us to treat areas that have notoriously been hard to treat, such as the neck and the chest and the back of the hands, and it's giving satisfactory results. Patients are finding their skin is smoother, more refreshed and a bit more rejuvenated. The overall feedback from the patients is they've been satisfied, they've felt it's worth the money, they're happy with the treatment, the downtime is short, the pain is little, the benefit is good for them, and so overall they've been happy. And we've done a study, an internal study of 30 of our patients, and overall I would say that 25 of those patients were very happy. A number of patients decided not to continue on with it, so they only actually had one treatment. I think it is important to make sure you have at least the 3 treatments to get the full result. Look, immediately after treatment there's a couple of welts, and those welts generally stay around for that day, so the patient shouldn't go back to work on the day. They can put makeup on after that and cover it and go back to work the next day, but there may be some very fine scabbing or crusting at the entry points, and that can linger for up to a week. Look, every treatment has risks. I think the risks are minimal. There's the initial bruising and soreness that can happen. We've not seen any infections or scarring or anything untoward. Well, I think it's an exciting technology. It allows us to get the hyaluronic acids under the skin without an injection. So obviously there's a lot of people who are attracted to that, not to have injections. But more than that, it allows us to get the hyaluronic acid into a diffuse field. So it's not just treating an individual line. And I think we're more focused as doctors on treating a whole picture rather than an individual line. I think it works well with other treatments. You can combine it with lots of other things, and it may even be combined with injections of individual lines or photorejuvenation. So we do other treatments together with it, and I think it's shown that using a number of different modalities together you get the best results. I think the Airgent is a great tool to have in our practice. It's something a little bit different. It works well with the lasers that we have. It allows me to treat areas that I've found difficult to treat in the past. The patients are happy, which is the main thing, and they're usually a good guide so they can tell the difference. So I think that's good. It doesn't have much risk. Which of course makes it beneficial in areas that are normally risky to treat, such as off the face. I think that we're going to learn more about it. I think we're testing it now on stretch marks, we're testing on different concentrations. I think it's a new field, and it's a simple operation. It can be done by the nurses, so it's not too complicated, and therefore it fits well into a medical practice.